Hello, good morning, good night. I'm Lucas Daniel Oliveira, a student of the 60th year of medicine in PUCPR. My advisor is Fábio Teodoro in campus of Curitiba. And I had a study of different characteristics between patients intubated with SARS, severe acute respiratory syndrome, due to COVID-19, and patients intubated with SARS due to other causes. All right. We know that COVID-19 brings to us a lot of difficulties all over the world, and the physicians had a lot of difficulty with complications of these patients. The complication is SARS. These patients will need the mechanical ventilation. And we know that SARS have multiple etiologies, such as sepsis, aspiration pneumonitis, severe traumas, pulmonary contusions, smoke inhalation, and others. We didn't know in the beginning of the period pandemic if the treatment was the same in the mechanical parameters. So this was the objective of this study, knowing if have different or irrelevant ventilatory or clinical parameters, comparing these two situations, patients intubated with SARS due to other causes and patients intubated for SARS due to COVID. So the material and methods used was articles published in Portuguese and articles in English between the year 2020 and 2022, because we didn't want to publish articles published before this pandemic and published in scientific journals, editorials, and case reports. The conclusion is there is no significant difference between in the ventilator parameters. Once diagnosed with respiratory failure, the treatment will start from the ventilatory parameters that each patient require. It means that is very specifically for the situation that the patient is. We need actually use the protect ventilation for the pulmonary alveoli, and this protect ventilation is very specifically for each patient. So this was the situation. My final consideration is we know that has a limitation of start moment for knowing when these patients entering the intensive care unit is if entering the correct moment or not. And we know that not all the professionals that these professionals, not everybody is 100% able to clinically manage the patients with ventilatory support. But we know that all over the world we did the best for these patients. So with this, I finish this. Thank you very much.